Hello and welcome to my page once again. This is going to be a very quick video, and I'm just making this video in reaction to a post I saw on social media a few days ago. And it's a female content creator, and she was writing on, I think it was Facebook. Her problem was that she is very upset with healthcare professionals, and by healthcare professionals we know who they are: doctors, nurses, physiotherapists, and the works, everybody who delivers healthcare, hospital setting or whatever case or whatever the case may be. And her problem was that why should they be on social media making content, and that she gets very irritated when she sees those posts. Now, this content creator is a female. This content creator is Nigerian, living in Nigeria. And I went to the comment section, and the comment section was full of people who were in support of what she said. And these were largely Nigerians living in Nigeria as well. I saw comments like, "Oh, that thing, I hate that thing so much. You'll just start dancing and then you begin to see symptoms of diseases," or they will just start dancing. And I'm like, I sat down and I couldn't believe what I was seeing. You see, because I have been very excited ever since I started noticing that there's been a lot of social media presence from healthcare professionals in Nigeria. For Nigeria, a country that is very backward when it comes to the number first and foremost of healthcare professionals in every single aspect of healthcare. The numbers are staggeringly low when you compare it to what the World Health Organization stipulates, and when you compare it to what is happening in other countries. The health-seeking behavior of the average Nigerian is extremely poor, and that is why a lot of people will end up in the hospitals only when the condition has reached a stage where you cannot remedy. Now, a lot of people don't even know that when it starts, they can go to a hospital. They don't even realize that the symptoms they are feeling are actually symptoms of diseases. So you can imagine my joy when I saw a lot of young people jumping into social media to inform the populace that, look, when you feel this and this could be this, and this is what you need to do. And then this madam comes out to write something like this in public. It was extremely disappointing because I've been seeing some of her posts and actually like following her content, because I assumed that she had more sense than she portrayed in that post. And I hope that was just a one-off. But I will always want to encourage my fellow healthcare professionals, because I myself am a doctor, I'm a surgeon, I'm a plastic surgeon, and I also do content creation on social media as well. And it's extremely frustrating when you see a young person come to a hospital with a condition that could have been remedied when that person had come even 1 year earlier or even 1 month earlier, and yet they sat down at home and didn't come. Many times it's not because of the funds. Many times the funds finally appear when they come at the advanced stage where you need a lot more funds to cater to your health. The funds appear. So I want to encourage my fellow healthcare professionals to please embrace content creation. Please do it with your full chest. If I want to say it the way people say, embrace content creation with your full chest, because you are doing this nation a great service. You're bringing your knowledge to bear in a space that is overcrowded by charlatans who have no training whatsoever, who are just out there trying to exploit the vulnerable population. People will come out and sell to you a drink, they call it bitters, and they'll say it cures bad dreams, it cures typhoid, it cures erectile dysfunction, it cures hypertension. One drink, the same drink, is curing all these things. And they're on social media, they're in their vehicles, in marketplaces, they're everywhere. Their voices are drowning out the voices of healthcare professionals. And somebody comes out to say healthcare professionals shouldn't be on social media. Why? Why exactly? I understand that you content creators, the non-healthcare content creators, your job is to go and collect a few coins and influence for nonsensical things that you call it, Botox increasing cream, breast increasing drink, and hypertension and erectile dysfunction curing bitters. I understand that you need to fool the public so that you can make a few bucks. But please, do it with some level of conscience. And healthcare professionals, please continue to create your content, continue to put good information out there so that you can drown out the voices of the charlatans, so that people can stop being deleted in their youthful ages. I'm sorry if this video comes out as being a little bit aggressive. It was not my intention. But sometimes when you sit in a clinic and you see a young woman, 30-year-old woman, coming to you with a breast cancer that could have been treated had she just come even 6 months earlier, and then she arrives it's already opened up, ulcerated, forms a massive wound, and it has spread to everywhere on her body, then you know that there is work to be done. There is work to be done. So please, dear Nigerians, anybody who comes across this video, when you see videos from content creators who are in the healthcare space, stop scrolling and watch, because you are getting for free information that people are paying with all their earnings, and some of them are paying with their lives. Some people could have been very happy had they gotten some kinds of information even 6 months before the current condition they find themselves. If you doubt me, take a walk to the hospital and see people of your age, young people, you know, hooked on oxygen, young people with all kinds of ailments that could have been helped, but because they had no way of getting that information, they were stuck with drinking bitters because their favorite influencer was promoting bitters. So please, influencers, try and support the healthcare space so that the healthcare can do for us what the entertainment industry is doing. I'm always very proud when I look at people like Davido, Wizkid, my favorite, Burna Boy, and the rest of them who are taking African music, Nigerian music in particular, to all the corners of the world. They're taking it very far. The government also needs to chip in their own bit. But the people themselves need to be reached. You have to understand that some of those good results that the Oyibos, a lot of those good results that they have is because their people come to the hospital on time. When you look at the ones that come to the hospital at the stage where Nigerians like to go to the hospital, you will find out that the results are basically the same. The cancers that go to see them, when they have already spread to all parts of the body, the results are almost the same with what you have in Nigeria. So a lot of the good results that we think we see from outside Nigeria, you have those good results not just because you have good facilities, which they do have. We have those good results because people go to the hospital on time, and they get to the hospital before the illness has gotten so bad that they cannot be saved by anything. So anything at all that healthcare professionals can do online to increase the knowledge base of the average Nigerian, that improves their health-seeking behavior, please, I am very much in support of that kind of thing. And you content creator, you know yourself, if you come across this video, I'm not saying this to malign you because I know you need traffic on your page, but please try and downplay all those beaters that you people influence for, you know. And also, if you cannot help the Nigerian healthcare, stop talking about us and let us do our bit to help this country. Thank you so much for watching. Please like and subscribe to my page, and I'll see you again in my next video. Hopefully it's not going to be a very intense one.